Welcome, welcome to the workshop on One Health and Security, safeguarding against emerging and re-emerging infections, veterinary and zoonotic diseases in Africa. In fact, if you see on my back, the workshop is organized ably by 3 partners, and one is Global Alliance for Pandemic Preparedness and Response. I will come to you what is this alliance is about, and ably with the International Livestock Research Institute under the CGIAR system, and also African Union Development Agency. I think Barbara and some others are representing already. At the outset, I would like to introduce myself. I am Dr. S.R.Rao. Earlier, I was 35 years in the government, looking after many areas. Now I serve as a vice president in a Swaramandal Coast, an university called Sri Balaji Vidyapeeth. I am in the studio of this university, speaking from there. We had lots of meetings from this forum at a global level. And I would just introduce you what is this Alliance for Pandemic Preparedness and Response is about. This global alliance is not a new idea. From 2017, we have been having a lot of discussions in India with national and international players in the area of One Health. As a result, particularly Penn State, John Hopkins, and DITRA, and ILRI also in some context. And what we did was, we had, as a result, several workshops leading to networks on anthrax, network on bovine tuberculosis, a huge network on brucellosis, including both human and veterinary aspects. Soon after we learned the lessons, and in the middle of COVID 2020, like-minded people at national and international level gathered across a Zoom platform. We thought it is the right time to come together to have a South-South collaboration, and also at the same time collaborate with North on knowledge and technology transfer. Because unless South and South collaboration happens, the technology access to vaccines, diagnostics, and many other things related to surveillance, etc., cannot happen, because we have a like-minded problems and common issues. But at the same time, we can't avoid technology knowledge from the North. With all this concept, in the middle of COVID pandemic in 2020, we had launched, about 20 of us launched, 3 co-founders. I'm happy to say that today all the co-founders, Dr. Kai from Penn State and Dr. Sachin Chaturvedi will be joining from a research and information system. He is a think tank of Ministry of External Affairs. He is also currently cabinet minister to one of the state government. He is a director general. And I am from the university system. We all joined hands as co-founders, and we launched along with many people at national and international level. You can see at APARweb.org. The launch is not also just by like-minded people. In 2019, we had a One Health conference. We have intersectoral discussions. In 28 countries participated, and then Penn State and Department of Biotechnology, Government of India made this happen. We at the end came out with a declaration. One of the points in the declaration, it is on the website of APARweb.org. And one of the aspects was to launch an agency to address these issues of South-South cooperation. And as a result also, aptly, the alliance came into existence. And today we are discussing some of these 10 points in the declaration. And we had one discussion at the global level. Dieter happened to attend that 5 hours marathon meeting with about 15 time zones and something like 50 experts speaking on that forum. There was a suggestion that, okay, at global level, we have a large picture, but it is also important to assess and understand what is exactly happening in the South-South collaboration. So as a result, we thought we will have some series of meetings, and we started happily when Dieter and the African Union helped us to launch and conceive this workshop. Although we postponed in between, and we had 8 months of severe discussion, intensive discussion, thanks to ILRI and all the scientists and the director of ILRI for facilitating such meetings and at odd times and at our request many times. And as a result, we are here. I am happy that all of you are here. I also welcome all of you once again. It's a very, very successful occasion that we are discussing issues.
If you guys are trying to skip Zoom classes, do something else like play for.
Hey, what happened? So therefore, I will hand over to Dr. Kai, my co-founder, who has been working on this agenda for a long time, to enumerate in detail what is the purpose of this meeting, where are we heading to, what are the expected outcomes, whether the declaration that we had has any meaning. We have to revisit those recommendations. After all, what will be the action point in future? Many workshops happen, but action points remain there. So now we are serious about going through the action points. Therefore, you find various stakeholders, including industry partners, in some of the sessions. I'll stop here and hand over to my partner, Dr. Kai. Over to you, Dr. Kai.
Thank you so much for that, Dr. Rao. It is truly a pleasure and an honor to co-host this really important globally relevant and timely workshop. As we all know, greater than 70% of all global emerging and re-emerging infectious diseases and outbreaks are zoonotic in origin. They emerge at the interface of human, veterinary, and wildlife health and are the direct result of habitat destruction, human migration, urbanization, climate change, and deforestation. Over the centuries, the world has repeatedly suffered through pandemics, including, as we all know, plague, smallpox, AIDS, Ebola, and of course, the latest COVID pandemic. All of them zoonotic in origin, all of them resulting in devastating human suffering and economic loss. Similarly, transboundary animal diseases such as African swine fever, foot and mouth disease, PPR, are highly contagious epidemic diseases that can spread extremely rapidly, irrespective of national borders. They cause high rates of death and disease in animals, thereby having serious socioeconomic and sometimes public health consequences while constituting a constant threat to the livelihoods of livestock farmers. It is our hope that this Africa-focused workshop will contribute to addressing these critical challenges. Taking a One Health security perspective, the workshop will focus on identifying challenges and opportunities related to these emerging and re-emerging infectious diseases, their impact on preparedness and response capacities in Africa, with a particular focus on identifying the gaps and priority requirements of what we might need to address. Our opening panel of global thought leaders will set the stage by illuminating the critical challenges we are facing, but also the opportunities we must seek to capture. This will be followed by an in-depth review of the impact of emerging and re-emerging veterinary and zoonotic diseases in Africa today. Tomorrow, we will deep dive into other key areas, including livestock biosecurity and climate change, social and behavioral interventions, vaccines and diagnostics, and of course, the need for technology innovation in a sustainable fashion. Please let me provide some administrative remarks to set the stage for this workshop. We really want to make sure that all of our global panelists have an opportunity to share their thoughts. Please stay within the times allotted for each panelist. As mentioned, the session will also be recorded. And if you would like to provide additional comments, please put them into the chat. So actually the panelists might be able to directly respond to either comments or questions you might have. Finally, please make sure that your microphone is muted when you're not presenting. So thank you for allowing me to co-open this workshop. And I look forward to the upcoming distinguished opening panel, which will be chaired by Dr. Dieter Schillinger, the Deputy Director General of the International Livestock Research Institute.